again. I always say like that because we did the hellos just 5 minutes ago. Thank you very much, Kornelia and Rarița, for joining me for this hopefully a fruitful conversation, professional conversation about culture and health. We will also address some pinpoint programs because they are not mere project, but programs, culture and health and culture for health, which you both are very much involved. But for a start, maybe it would be I don't know, useful for our listeners to see what would be the connection between culture and health. How was this subject, well, theme, a concept team approach, if it's a connection or not with the pandemics. And then, of course, we can move a bit on specifics for Romania, and we'll talk about a research that Rarița co-authored. But then, okay, let's go back to a report that you both coordinated, is the Culture for Health report, and maybe you can help us understand why health and culture can go together, and further on how based on the research and on the evidence that you gathered, how would you push all this information for the policymakers in the health but also in the cultural field. Please, please, you can choose how to begin, please.
I could start a little bit with maybe with your first question, like why this connection between arts and health. And I always like to say that this is not new. Like right now, in terms of policies, this is an emerging topic, and we see that new measures, fortunately, are being taken in this direction. But we have, like, since throughout the human history, there has been a link between health and the arts. And we know it especially from, dancing around the fires, dancing when someone is born, and dancing and singing when someone is dying. So things are tightly connected. Arts and different stages of human life are connected. But we also know, like in the ancient Greece, you had Asclepios, that was also being a patron of healing, but also of the arts. So and there were the temples and so-called places for healing and the arts. They were very closely related, so they were always there. And I think the artists always knew, looking at the faces of their audiences, that there is a cathartic transformation while you attend to cultural activities, and especially when you are engaged with creative activities. And now I think in the past few decades, there's also increasing attention from research to document that. And I think you named the word pandemic, and I think pandemic is just a starter, but I think there's the multiple crises that we are actually facing nowadays that definitely bring the attention towards the need for new types of solutions that empower and enable people to deal with the complexity of the reality that we are facing every day. And obviously there's so many health challenges, especially mental challenges, that go beyond the capacity of existing systems. So in this context, we are reinventing, in a way, something that has always been there, namely that there is a connection between arts engagement and health and well-being. And because this has been more research and there's more evidence now, there is also much more practice. And I think there's in the past 5 years, I think it's an exponential increase in the number of activities that are happening throughout Europe and probably throughout the world, that are initiated by artists or by health professionals, but engage artists. And also, I think rather in a reactive manner, also policies are being developed. That would be my first answer.
Yes, and answering to your question, whether the pandemic has helped it, definitely, I think because decision makers experienced being socially isolated and often turning towards cultural activities in their home, there were also more open ears, let's say, to the evidence that was out there. And more concretely, actually, I think how it further triggered, because of course how it further triggered was that the fact that during the before the pandemic, the European Commission announced that they would like to do something which is a conference on the future of Europe. They were about to consult everyday people from the European Union on what the EU should focus on. And because the pandemic came, actually many people were saying, you have to do something about mental health because there is an issue here. And this is why actually the European Commission, just when von der Leyen's 4-year term was about to end, kind of launched a comprehensive approach to mental health. Europe Commission communication, because they wanted to deliver on the plea of the everyday people from the European Union. And because the CultureForHealth report was just being written at that time, it was actually a very nice entry point there to really make sure that culture is on board in this comprehensive approach to mental health, that engaging in cultural activities definitely contribute to our mental health. What is very interesting, I think, is how also things are shifting, that there is also this very big loneliness agenda where more and more people feel lonely. And it's not only the elderly. Research actually shows that young people are feeling very lonely as well, although they are not socially isolated. They are going to schools and so on, but they still feel lonely. And connected to the mental health crisis, now the loneliness agenda also kind of surfaces this fact how much our social health should be valued as well. And beforehand, or actually even until today, your social health is a little bit a subset of your mental health, they were thinking. And now the discussion is going that maybe it's just as on equal level. It's not a subset, but it's like how you categorize it. It's to be honest, not really important. You are complete with your mental health, your social health, and your physical health, and they are interacting with each other. And maybe we shouldn't even call them separately because you are just one. It's a comprehensive approach. So I think really the timing of the pandemic and what the EU citizens were asking the European Union to do was a special moment that kind of created more attention and political attention on EU level on this. I must say that beforehand it was already existing, especially in, let's say, the UK or the Nordic countries. But one thing that I would also like to add that during this process that we are talking to member states, there is also a little bit of looking at the same thing through a different angle. So, for example, there was socially engaged art for quite a long time now, named like that, let's say, and we are saying that many of the social engaged arts, which is about well-being of maybe certain marginalized populations, are actually interventions or projects in the area of prevention and early action from the health point of view, from the health and the well-being point of view.
It's very interesting that you made the connection between health and well-being, because and mental health as well, because maybe people when see culture and health, they think, oh, the artists go to hospitals and there they help, they do, I don't know, shows for people that are already ill there, or they're having different diseases, but so they go directly to like a health problem. But when you say well-being, actually, and you also mentioned social well-being, actually it's your day-to-day approach that should be addressed. So of course, and you mentioned quite well, I mean, you go to school, to job, and then you go home, but then all these gaps, so to speak, that if they are not filled with meaning living, then of course you can reach a point where you go depressed, or you go burnout. So maybe and then we move on, maybe from this report, how would you was your technical approach? How did you gather information? I mean, in what form did you gather information to then to put it together like an evidence, and then to present it to policymakers? How did you what methodology? Because I think the technical part is also important, so that you would know if you addressed specific art types, or you address a specific, as you mentioned, specific socio-economical or specific ages. So how did you approach this subject?
Well, first, also to link a bit to your comment just before, the way in which the Constitution of the World Health Organization defines health, it implies that health is a complete state of no, don't know exactly the words of functioning, which is not does not refer only to functional functioning, but also well-being. So a person's capacity to thrive. So health as such should be imagined also as well-being, but unfortunately, most of our systems are thought to mainly deal with, let's say, the already installed disease, and there's very few efforts related to health promotion and prevention. And that, as we have been showing in the Culture for Health report, is less than 3% of the European budgets, so across the member states, for health, that is being spent on preventive care. So it shows that we are actually coming now with this approach based on culture, tapping into a very unexplored potential, that of increasing this attention to for promotion, for health promotion. And yes, in our report, we were looking exactly at these aspects. We wanted to tackle the aspects related to health, but also to how people perceive their own well-being, so namely subjective well-being, how they define their satisfaction with life and sense of meaning in life, for instance, but also how cultural engagement contributes to a sense of community well-being. So the type of studies that we have been looking at in the scoping review that we put together for the Culture for Health report was looking at these three categories of intersection between culture and different well-being outcomes. When it comes to health, I think it's important to say that before the Culture for Health report in 2019, the World Health Organization came with an important document, which was a scoping review that was looking into 3,000 articles, scientific articles, and putting together the existing evidence at that date, on how culture engagement, arts and culture engagement contribute to both health promotion and prevention, but also as part of protocols for treatment and management of existing disease. So in our case, let's say what we brought new, we were kind of adding to we use the same approach as the WHO report for the health related evidence, but we added the subjective well-being and the community well-being dimension. And we also had, because the report was happening right after the pandemic, we also had a small part of the research looking at that time very little evidence about how people engaged with the arts during the pandemic and what have been the findings of that. What probably it makes sense to say is that this was a type of review that looked broadly at the existing literature to show what exists there in terms of research and types of outcomes, so types of well-being outcomes that are being highlighted by different type of research. There's a lot of research that goes into much more depth and methodological rigor when it comes to especially systematic reviews that take, for instance, subjects like cultural prescription, and then they would review the existing literature and would give much more precise information, like, for instance, what does it mean to work on arts on prescription? Who are the beneficiaries? What are what is the evidence about the outcomes? So we had a much more general approach, and our aim was to present the decision makers with a picture of, in a way, what we did, we created a map of existing evidence. So we have around 30 categories of outcomes. Yes, so much more types of benefits, but the categories of outcomes are quite many. And we also looked at pilot projects and case studies, and developed a series of broader policy recommendations. Again, when I say broader policy recommendations, we looked at policy recommendations that were mainly based on policy dialogues with decision makers and culture professionals that already had experience in this type of collaboration, and the recommendations, and probably Kornelia is willing to add more detailed examples. There we were looking at how the sectors could or should collaborate, how more research could be furthered, and how and what we were trying to show is how some of the current challenges, the major global challenges, could be tackled by engaging the arts. And Cornelia already pointed to some of these challenges, like an aging population, a very rapidly changing field of labor, of work practices with AI and technologies, and the pandemic. So a field of work that is rapidly changing, that also has a huge mental health impact on active workforce. There's again a lot of challenges related to youth mental health, people forced to migrate because of war or climate change. So we pointed to more such challenges and tried to exemplify how engaging with the arts could ideally and potentially support our society to face those challenges.
Yeah, and just more concretely, if you want to know, in the scoping review, I think they were looking, or actually it was mostly Rarița and her team, looking in 2 scientific databases, and probably for the first time we also looked at the well-being part in a sense of which kind of resulted a lot of studies that we just said were not falling into the scope of the study. So just to give an example, the 8,000 abstracts were looked through, and 310 made it to the CultureForHealth report. So it was an incredible job. And Regarding the policy part, it is not necessarily connected to that set of evidence gathered, but we were really talking to practitioners, artists, and also patients and so on, and try to understand what are the difficulties in these fields. And really try to show a way how to come out of it, or at least we always ask what are the challenges and what would you like to have. And we had a series of roundtables, but also many more online meetings to get that together. And it was very nicely then through discussions categorized into these 4 blocks of dedicated and strategic financial support, knowledge and awareness building, the need for training and peer learning, and also to localize these culture, health, and well-being discussions, as well as policy discussions. And this is what was actually also, again, a little bit of luck, to be honest, because just when the CultureForHealth report was being written, that's when the EU member states decided that was the time when EU member states had to decide on what are the topics they should be working on in the next 4 years, what is called the Work Plan for Culture. And they decided that this is a topic that should be taken up, and there should be a so-called open method of coordination group formed from the EU member states to see how culture and health can be brought better together. So this created a 1.5 year of work in between member states, and the report of it has just come out in September 2025, end of September. It's called Culture and Health, the Time to Act is Now. And it has actually brought these policy recommendations again to the next level. It is not a duplication. It is definitely an evolution of what was out there already, and it also hopefully will be a good roadmap for EU member states to start bringing their policies together between culture and health. It kind of really just writes down what would need to be done, and it's not going to be done in 1-2 years. It's a long process, but if we don't start it, we will never get to the desired outcome.
Yeah, it's a good point. Apropos these theoretical frameworks, because policies you can say there are theoretical frameworks, and then moving to practical implementation. So actually, just a bit of information, if you can give. Or to give an example or two, how would this hopefully perfect cultural health policies would be mirrored at the grassroots level or the national level, so to speak. So it can be, I don't know, it can be a priority in a national fund. It can be how I mean, if you can give us an example or two, knowing all these types and putting forward your report recommendation on practical terms. What can be done? I mean, if an artist wants to work within this field, what to do, where to go. If a cultural operator wants to have a project dedicated or some activities of their project dedicated to this subject, how they should start, where to look for a specific type of personnel, what type, I don't know, I have to work with a psychiatrist, I have to work with a doctor, I have to work with whom. So maybe just to narrow it down to a practical bullet points for those of us who would really want to approach this subject.
So just to say that there were a lot of bottom-up initiatives already happening, often unpaid or not sufficiently paid already. So that's what we saw, that there is a proliferation of these type of projects, and we have collected them in the so-called CultureForHealth database, mapping database, which is on our website. And currently there is over 850 such projects included in that database from all over Europe, but also outside of the EU. And we think it's a very good tool for artists and practitioners to see what is out there, because you can search, for example, by art field or by target group. And if you would like to have a project for elderly with singing, let's say, then you actually get that list there. And also there is free text search. So there are a lot of ways to find the good things there. And why it is helpful, not only just to see what others are doing, but we always say it's a very good possibility to learn from others and not reinvent the wheel, but go to the next level, understand what the issues there might have been, and already tackle them in advance. So we are not reinventing the wheel all the time. So that would be one of the things. And this is exactly what we found, that you have all these bottom-up projects, but if there is no support from top down to this field, it will remain very sidelined, despite the growing evidence that is actually very beneficial for people, and despite the crisis that is currently, the multiple crises that are currently in the world. So there is a sense of urgency, and therefore policy makers have more open ears, let's say. So one of the things that we were saying is that there should be a dedicated calls for this area, because if you apply for a cultural funding, maybe there the requirement is to be innovative and so on, and therefore it will not be the first projects chosen. But also if you go to the health side and apply, maybe if you are eligible at all, because that's already the first issue. So if you apply for a health funding, then you get the issue of like, we have all these priorities in health, and which are you kind of trying to tackle? And many of these projects are actually, even if you're working, let's say, with cancer patients, we can also say that this is while working with cultural activities with cancer patients, you're actually possibly preventing secondary diseases, like, for example, depression or mental health conditions because of the primary, let's say, illness. So we really have to see these connections. So that was our first stop, let's say, of like, have a dedicated call for policymakers. And many countries have been trying to do that. And of course, one of the avenues that the health sector already is exploring is the social prescribing. And within that, this culture-based social prescribing. And that is a good methodology that is already tried and tested. But we also think through pairing of institutions, for example, if you have an elderly home very close by to, let's say, a conservatorium where you have musical students and so on, there is so much opportunity there. One is looking for reaching out to maybe marginalized groups, and also maybe looking for audiences to play at. And then you have the elderly care home next by who actually need activities. And there is just so much possibility to help each other in that way as well.
I would add to that the fact that when we are advocating, we're always paying attention to ask for budgets to be dedicated for this type of activities, not from the cultural budgets. And that is important because there are concerns in the cultural sector that the already limited resources of the cultural sector are going to be used for a health agenda. So, and there are examples of countries, especially at regional level, where the local authorities, well, regional authorities have a competence both on health, social care, for instance, and culture. There they can create programs where funding is dedicated to this type of collaborative projects from exactly from that level of the regional budget and not from the cultural budget or specifically from the health budget. Let's say budgets dedicated to increase well-being or prevent deterioration of mental health, and when it comes to individuals, like people working in the arts that would like to take up such a career, I think one of the things is, as you hinted, one is that simply your artistic training would not be enough there, and it's not necessarily, depending on the type of activities that you would like to engage with, you don't necessarily need long-term training, but it's useful to be part of a capacity building activity that prepares you in several aspects. What it means to meet vulnerable people, to be able to read some of the symptoms, to learn some of the safeguarding protocols in, for instance, in health or social care, so that everyone, including the artists themselves and the caretakers themselves, are being taken care of in this entire process. So I think training is an important thing, and to have training and to learn from the others. As Cornelia mentioned, now there is a lot of evidence, and there are a lot of initiatives, especially grassroots initiative, and I guess what we really lack now is more structural responses. So I think the policy level and, let's say, the middle policy level, the institutions, in terms of calls or training programs, need to respond to to this very active grassroots activity. But to really bridge this gap from top and down, we need to create this peer sphere, and that means networks, means, for instance, this culture and health mapping that Cornelia mentioned is one of these things that is a resource that is made available for people to know what has been happening in other countries or in their own country, to get inspiration from, to be able to contact each other. But for instance, there is also currently the Culture and Health platform that Cornelia is managing, which is bringing together practitioners in this field to be connected and to offer them not only the possibility of dedicated grants, but also mobilities and training capacity possibilities, so that they learn from professionals with more experience or from their peers. And I think there's still a lot to be done in this aspect of networking or creating alliances between professionals from these different sectors. And though we usually talk about culture and health, I think for me there's always, because we were talking about well-being in the beginning, there's always a much more um, diverse interdisciplinary circle here. It's very tightly connected also to the social care system and services, education, because, for instance, if we are really trying to think idealistic on how we can move towards a society in which indeed the well-being of all can be more part of the everyday reality, it means that healthier behaviors are being formed at a younger age. And obviously school should be one of these places. And unfortunately we see nowadays that actually the school is one of the places where young people rather tend to lose their mental health than to be supported. And that's why we are looking at how arts engagement in school can become part of school, not only because arts training is good for your creativity, for preparing you for your future job, but also for your life skills, for how you interact with the others, for how you learn to navigate your daily realities, so you don't fall into risk behaviors, which are very likely to happen at adolescent age. So I think this is a complex sphere. So another element where very concrete steps can be taken is where these organizations can meet. And Kornelia gave the example of two institutions being in the vicinity. And there are countries like, for instance, like France, where there is already from the 90s an interministerial agreement between the Minister of Culture and the Minister of Health, that such partnerships are being created. So there is a more consistent presence of cultural activities in the health sphere. And of course, for instance, in countries like Romania, where this is not happening with the support of such or the endorsement of such policy, these things already happen in some places because of particular initiatives of cultural organizations and hospitals or elderly care centers. So I believe immediate things can happen by the fact that people that have the interest, intention, passion get together.
Yeah, thank you very much. We will give also the link to the map, to the database, definitely for our colleagues that are interested. And because you both mentioned prescriptions, and be it cultural or social cultural, maybe Rarița, you will hold on to your mic and maybe tell us a bit about the exploring the opportunities, the study that you did for Consiliul Economic și Social. The Social and Economic Council last year, together with Christine Palaga, and maybe you can tell us a bit about if you had some models, or you have some input, or some you looked in a particular country or a particular methodology to propose that. And most important, if you think or you believe or you have already seen, well, it's too soon, but if you believe they can be maybe not necessarily immediately implemented, but taken into consideration in Romania.
Well, briefly, the concept of art or culture on prescription is what the name also says, is that doctors or social carers could prescribe engagement in cultural activities to individuals that are for instance, that suffer from a specific illness or are in a certain risk, like let's say young people that are coming from vulnerable socioeconomic contexts, and according to the studies, their health is at risk, for them, for instance, engaging in group activities could be a factor supportive for their mental health and well-being. So then, based on this recommendation, this individual comes into an artistic activity, which usually it is an artistic activity that happens in a group and is facilitated by someone that has the right set of skills for understanding the particular condition of that group of people. And such programs have been developed in almost all countries in Europe, either at the level of pilot projects or at policy level. So there are a few countries where this has been implemented at policy level. And the formats differ quite much because they have to be related with the overall social, health, and cultural policy framework in that particular countries. What is the, you know, the circuit in terms of resources and collaboration in these fields in different countries. In Romania, with the study that you mentioned, that we developed for the Social and Economic Council, we wanted to see how we could approach this in Romania based on the existing legal provisions. So we looked at the Romanian legal system in terms of several sectors, so youth, social care, health, and the needs and opportunities in the cultural sector. And we try to see, in collaboration with experts, what could be the, let's say, the most easy to reach entry points into the system to create such collaborations. We also looked at some case studies from different countries, and we proposed several scenarios of how such a mechanism could be developed in Romania, either for a particular target group from the beginning, for instance, to focus on youth with special needs, or to focus on elderly that are isolated, and to go with a pilot project that will show after a period of implementation, let's say 1 or 2 years of implementation, how this works, how it can be improved, and how it can be generalized to more target groups. Or to go with a more localized pilot project, let's say, where in a specific city, where you create a collaboration framework for more institutions from these different sectors. It's obviously not a simple answer, and I think it's mostly due to political will, if this is something that is being taken up. I think one of the things that is important for us is to make sure that this type, so the idea with this social prescribing is that ideally, just as going to physiotherapy, which is a complementary act to the medical act, could be supported from the medical insurance, participating to cultural activities that will be supportive to your health would be deductive from this type of cost. I believe we are still far from this, and I think we are cautious to advise for many in between systems that would not ensure that all these different stages of this process would be adequately funded.
Thank you so much. Yes, I don't want to say we are far away land from this, but I keep the hopes up. And maybe at the end of our discussion, maybe of course Rarița was there as well. Kornelia, you co-organized. You didn't only participate in a conference in Turku in Finland. Few weeks ago, so that's not few days, and maybe you can share just some examples maybe from the Nordic countries, which maybe can be good practice studies, how they approach this pairing culture and health, and or why not some examples from your partners in the culture and health project of Culture Action Europe, please.
Well, actually, one of the biggest things that struck me there, and it was an absolutely new thing also for them, in Denmark, the policy on, what was it? On mental health, I think, was just expiring. And there was an institute who already worked on culture and mental health as a research institute. And they were just at the right time, kind of saying, hey, you're looking for new approaches, new innovative ways. This is one of the ways you can help mental health. And currently, that organization got funding from the health sector, and it's not one, year by year funding, but it's a permanent funding. So that I think is really a huge step there, and I can't emphasize how important it would be to not to have this project by project approach, which is also a little bit let's say the backfall of arts and prescription as well, that many participants feel that usually there are around 8 to 10 sessions with cultural activities where there is a group cohesion formed and so on. And while of course we cannot support all the time the hobbies of people, that we also totally understand that that is not the way to go. But definitely if in societies now we could create these connections of like, okay, once these like interventions of arts and health, arts and prescription, and there is actually a place where you would go. In my dream, actually, it would be that maybe cultural centers, which are actually quite many in Romania, but also in my home country, in Hungary, they would offer they would offer 4 or 5 different type of cultural activities, and then people could go there. It's a little bit like a gym, let's say, that you go there and you decide which machine or which Zumba class or Pilates you're going to be part of. And if people would have that knowledge now, and this we are trying to do through the CARE project, you see Rarica's background that is currently having an awareness raising campaign on for general people that cultural activities benefit or mental health and well-being. Then people would not only think, oh, I have to do something for myself, let me go for a run, but they also have it like, okay, let me do something cultural because that also benefits me. And I think cultural centers or libraries could be a good places to welcome these people on a longer term, and constantly offering that possibility, and whether it's funded or not, that we can, I mean, for the participant itself, that's another question. But still, the possibility is there, and it's not a closed group.
Yeah, it's a good approach not to consider it like a luxury or something that you give yourself like a treat, but to be like a normal everyday regular activity, just to go to the theater or I don't know. So yeah, it's a good point and a good comparison. Yeah.
And if I could add to that, actually currently, and especially in the case of women, sometimes if you go and sit down to read a book, you feel you have a bad conscience because you are not doing anything productive. No, you are not washing the dishes or doing the laundry. And actually just knowing that actually what I'm doing now is also kind of a good thing because I like it, and not have that bad conscience, that's already a big step.
Yeah, definitely. Here, girl power. Okay, thank you.
Yes,
Yeah,
and you know,
exactly.
actually, the evidence, there is evidence that, you know, on one hand, that just engaging with the arts is good for you, it it helps your mood, it helps your social health, and it can have different other positive benefits. Let's call it, it's a health protective factor. But on the other hand, there's also very targeted and specifically designed initiatives that are addressing particular groups, like for instance people with dementia, especially museum related activities, or people with Parkinson's, dance related activities, that already are very well researched, and there are protocols developed, so they are being implemented currently almost everywhere in the world. So there are all these dimensions. So it's a, under this name of arts and health, culture, well-being, there's such a diversity of practices. And the good news is there's something very simple you can do for yourself, for your small community, by engaging more with the arts. And with one of the study that stays behind the campaign that Cornelia just mentioned, there's also this scientifically proposed dose of around more than 2 hours per week that are already supportive of your health, you know. So okay, if you are reading 20 minutes a day, or in the weekend you go to a performance, that's already the 2 hours. On the other hand, if you're an artist or a cultural organization, there are very different ways in which you can add to your community contribution by, for instance, if you're a museum, you can develop in your audience development program, so you don't have to, let's say, you don't have to develop new programs, but rather extend your activities so that your audience or educational department is also welcoming different groups with different needs, understanding that their engagement with their collection, with their exhibitions, can bring health benefits, well-being benefits for these communities. And I think, in a way, what I really like about is that um, we are bringing humanity back into what we understand nowadays to be health. You know, nowadays you are a patient, and when you're engaging in the arts, even if that is happening in the hospital, you're a complete human being again.
Thank you for that. Yeah, definitely. An enormous step, yeah, in your mind. Thank you so much, Kornelia and Rarița. Hopefully it was an enlightening discussion for our colleagues and listeners. I will definitely put the links to all the resources that you mentioned, the database, the studies that you unfolded, and hopefully we'll meet again in live conditions. This is what I want when we have online discussion. We do hope for offline encounters. So thank you so much.